Welcome back, guys. Let us start with medical termination of pregnancy. So, about 45 to 50 million of medical termination of pregnancy (MTPs) are performed in a year all over the world, out of which, it accounts 1/5 of the total number of the conceived pregnancy in a year around the world. Government of India legalized MTPs in 1971. Okay, so this is the second data in this particular chapter. The very first was 1951. That was the year from when family planning plans were initiated in India, and here come the MTPs were legalized by the government of India in 1971. So now the question appears that why MTP? Obviously the answer will be to get rid of unwanted pregnancy or due to the casual unprotected intercourse or the failure of contraceptive use during the coitus or rape. MTPs are also essential in certain cases where the continuation of pregnancy could be harmful or even fatal, either to the mother or to the fetus or for both. Okay, MTPs are considered relatively safer in the first trimester, that is up to 12 weeks of pregnancy, while in the second semester, abortions are much more riskier. MTPs which are performed illegally by unqualified quacks or for misusing of the procedure amniocentesis to determine the sex of the unborn child, these are completely considered illegal, and therefore these practices should be avoided because they are dangerous for both the young mother and the fetus. Coming to our next topic, that is sexually transmitted infections, STI. We can also refer them as venereal diseases, VD, or reproductive tract infections, RTI. There are two bacterial sexually transmitted infection as per NCERT, that are gonorrhea and syphilis. Gonorrhea is due to the bacterial agent name Neisseria gonorrhoeae, and syphilis is curable and is caused due to Treponema pallidum. While coming to the viral diseases that are mentioned in NCERT under the topic of sexually transmitted infections is AIDS, that is caused by HIV virus, hepatitis B, that is caused by hepatitis B virus, genital warts, that is caused by human papilloma virus, while genital herpes is also a disease caused due to virus. Except for hepatitis B, genital herpes, and HIV infections, other diseases are completely curable if detected earlier and treated properly. Early symptoms of most of the STIs can conclude itching, fluid discharge, slight pain, swellings, and so on in the genital region, while the absence or less significant symptoms in the early stages of infection would lead to a bigger disease in the future if not detected timely and given a proper treatment. Okay, so these could lead to the complication or the diseases like pelvic inflammatory diseases, PID, abortions, stillbirths, ectopic pregnancies, infertility, and even cancer. Okay, so STIs are a major threat to the healthy society, while the most high rate of vulnerable diseases are caused in the age group of 15 to 24 years. So one could be free of these infections by simply following some of the things, that is like avoiding sex with unknown partners or multiple partners, always using condoms and contraceptive methods during coitus. In case of doubt, one should go to a qualified doctor for early detection and get a complete treatment if diagnosed with infection. Okay, so coming next will be our last topic of this particular chapter, that is infertility. So infertility is inability to conceive even after sexual coitus of 2 years. The main reason for infertility can be many, like physical, congenital diseases, drugs, immunological, and even psychological. But in India, often the female is blamed for the couple being childless, but more often than not, the problem lies in the male partner. How come? There can be two situations, that is, absence of sperm, that is oosospermia, while the second can be less sperm count, that will be known as oligozoospermia. Also, erectile dysfunction is a major cause in which the male partner is not able to get a child, right? While in the case of females, if no ova is present, so that particular disease is known as polycystic syndrome. But the good part is that corrections are possible, right? So couple can be assisted to have children through special techniques commonly known as assisted reproductive technologies, ART. Okay, so starting with IVF, that is in vitro fertilization. This is the fertilization outside the body in almost the similar condition as that in the body, which is followed by the embryo transfer. Embryo transfer is abbreviated as ET. Now, in this method, popularly known as test tube baby program, ova from any wife or donor female and the sperm from husband or donor male are collected and induced to form a zygote under the simulated condition in a laboratory, while the zygote or early embryos with 8 blastomere, okay, could be transferred to the fallopian tube, which is known as zygote intrafallopian transfer, ZIFT, and the embryo more than 8 blastomere are transferred in the uterus, which is known as intrauterine transfer, and then the complete further development takes place in the uterus. Embryo formed by in vivo fertilization is the fusion of gamete that takes place within the female. Transfer of an ovum collected from a donor into the fallopian tube of another female who cannot produce an ovum but can provide a suitable environment for fertilization and further development of the fetus is known as GIFT. So, gamete intrafallopian transfer. Another method is intracytoplasmic sperm injection, that is ICSI, which is a specialized procedure to form an embryo in the laboratory in which sperm is directly injected to the ovum. Infertility cases either due to inability of the male partner to inseminate the female or due to the low sperm count in the ejaculates could be corrected by artificial insemination technique. In this technique, semen is collected either from the husband or a healthy donor and is artificially introduced in the either in the vagina or in the uterus, that is IUI, intrauterine insemination of a female. So IVF, in vitro fertilization, ART, assisted reproductive technologies, ET, embryo transfer, test tube baby, ZIFT, zygote intrafallopian transfer, IUT, intrauterine transfer, in vivo fertilization, GIFT, gamete intrafallopian transfer, ICSI, intracytoplasmic sperm injection, AI, artificial insemination, IUI, intrauterine insemination. Here we are at the end of this chapter. Bye bye. Thank you.
Goodbye.